So my first question to the group is, how has COVID-19 affected church congregations and the way that they worship?
Okay.
Who would like to go first?
I'll go first.
Okay.
Well, speaking from my own perspective as pastor of Christ Missionary Baptist Church, which is a predominantly, or I would say all Black congregation, we have had to transition quickly to from in-person worship to a live stream platform. And we've been doing that, I would say, for the last 11 or 12 weeks. Since March, the third Sunday in March, we transitioned to an all live stream digitized worship experience. And of course, one of the reasons why we transitioned to that is because I chose to put the safety of our congregants above expediency. With this virus being as fluid as it is, and with no vaccine available, I just decided that it would be in the best interest of the safety of our congregants to move from in-person worship to live stream, and we will continue to do that until further notice.
Great. Okay, and Dr. Robertson, can we hear from you?
Well, I think we've been on the same schedule as Dr. Stewart, but we were, I would say, forced to it. But it wasn't any decision, because within the first couple of weeks of the pandemic, one of my assistant pastors, a very, very close friend, Tim Russell, close friend of all of us on this panel, passed away with the virus, and he also happened to be African American, and not really any underlying conditions, but we are intentionally reaching out to heal as a predominantly white community by pursuing that diversity of heaven. So we were concerned about the health of our members, especially our African American members. But I say we were forced to it because my whole worship team was in the room with Tim, planning worship while he was infected. So we were all in quarantine for the first 2 weeks. We had no choice. We didn't have anybody left to field to host a worship service anyway. So we had to learn a lot in a hurry. And then we stayed in that mode until now. And I'll add one other thing, that because about a third of our worship leadership is African American, we have worked very closely with Baptists with a really avant-garde system they have for weekly testing. And so I'll go from this meeting, I'll go over to Baptist and get tested like we do weekly, all of us who are participating in worship. And we are especially being mindful of our African American leaders on the platform who have been disproportionately affected by the virus, and we just don't want to take any chances. And so we're very grateful. I mean, it's been a terrible experience. It's lamentable. It's horrible. It's heartbreaking as Christians not to be able to gather in person and experience the Spirit among us, right, Dr. Stewart?
That's right.
Dr. Norman, all of you understand this is not who we are. And I'm someone who battles. I openly talk about my struggle with anxiety and depression, and major symptom of anxiety and depression is being cut off from people. Mm-hmm. So we're prescribed, as one of my friends said recently, we're prescribing the symptom. we're telling people to stay away. And preacher, you stay in your closet, especially because you're going to be spitting on the rest of us. We don't want to get infected by you. So been a great struggle, but we're very grateful for the partnership we've had among fellow pastors and other churches in a similar struggle, and thankful for Baptist partnership in this testing program. And let me just say, the incredible care they gave to Tim Russell. He passed away there, but we could not have asked for better care for him. Those dear nurses and physicians who prayed with him, who sang to him, who were his family when none of us could get there, who called us and wept with us. Thank you, Baptist, for walking with us in the struggle.